Hello and welcome to number 9 in our AFBSS webinar series. Today's topic is workforce recruitment and retention. And now, without further ado, I'd love to pass it over to our presenters, Suzanne Daub and Karen Hill.
Karen Hill. I'm the nurse in the Walnut Creek, Northern California area, and you've seen me at the liaison meeting. I was on the call, the regional meeting, and so you know me. I'm going to hand it off to my colleague Suzanne Dobbs so she can introduce herself.
Hi, everybody. I'm Suzanne Daub. I am a licensed clinical social worker. I've had a lot of experience, continuing to, in fact, having active experience, uh, consulting and doing work in integrated care. So I am really happy to be joining you today to talk about workforce. Karen, I will send it back to you.
All right, thank you. So let's go to the agenda. So I want to just tell you quickly what we're going to talk about today because it's very important. We're going to do an overview of workforce systems and needs, the differences between working inside the four walls and outside the four walls, the workforce that you need and the competencies for that, how to retain that staff and the supervisory needs and strategies that are in alignment with staff that's working in different environments, and field-based safety. We want you to also chat in notes and questions and things for us. We're going to try to answer those questions. We may not, but we will answer them in and send them out to you after the webinar is over if we do not get to them today. Very glad you're with us today. Let's go to the next slide. So what we're hoping that you walk away with at the end of this session is to be able to describe one defining feature that distinguishes field-based integrated services to the differences of working in a traditional four-wall environment. Just one or two things. Identify at least two essential soft skills that are required for effective practice in street-based medicine. That's what we're really talking about here. And one evidence-based strategy for retaining staff in the field. Next slide. All right. So we want to do a little bit of an overview in general. The first section provides an overview of the workforce. So BSHA, that's sort of improving that access. BHS is the provider. And then AFBSS is sort of how we get those things done, right? So the BHSA, the Act, supports the BHSS goals and objectives. And so as we go through the presentation and give you information, we want you to consider at your own sites, what policies and procedures, protocols, what changes are you going to have to modify? What things are you going to have to do differently in order to meet the goals of the AFBSS workforce? Next slide. We always like to start with an exemplar. And this is a fictitious clinic, but we want you to think about them as we move through the presentation and how they may look similar to or different than your own sites. So community services made up clinic, they provide outpatient medication for opioid use disorder. They have peer support services. They have telehealth. They make referrals to community. They even provide 24-hour opioid treatment, in an open access clinic. They're really doing a lot of stuff here. And then they also provide services correctly to the underserved, the most needy of individuals. They're doing that. They provide education and outreach to that group of individuals with opioid use disorder. They're serving the population 18 to 70, so they have a wide breadth. They're using their data, and it's also identified that 16 to 25-year-old females are much more likely in this population to be a test positive for fentanyl. So that's really an issue that they've been trying to focus on. And so they also serve individuals across the biopsychosocial network, so of all racial and ethnic groups. And so many of their clients are also unhoused or precariously housed. So there may be some similarities in your own populations. Let's go to the next slide. This is fictitious. Now, part two of CS Clinic. They're doing all of this good work already, but they face some workforce challenges. You know, we had the pandemic, there's shifts in the social and political environment about how people think about this work, funding changes, and all of the pressures that have come with that, right? Leadership has now charged them with expanding their services beyond the open access to also providing field-based services, meaning a boots on the ground, taking the care and services to where clients are. So I want you to consider how CS may develop a training or workforce stabilization plan. That's what we're hoping to be able to give you some information, because a lot of you are going to be dealing with that or are dealing with that right now. So after reviewing, they did some interviews with staff, supervisors, managers, leadership interviews. They did some surveys to determine really what was needed. They identified job competencies, workforce selection and training, who these people are going to be, and retention needs. That's what they really felt like they needed. Let's go to the next slide. So that's really the conundrum that we're in. But let's look at really what the differences are between the two services. How is traditional behavioral health services delivered than street-based, boots on the ground in the community? I would say in two big buckets. Traditional behavioral health services are the client is coming to your house. They're in your service. They have your service model. You have a different engagement philosophy. There's a different view often of substance use disorder. And then the workforce composition is different. Assertive field-based initiation and services really is we're taking the care to the client and you're in their home. Things are very different that way. Office-based hours, it's more of a controlled environment as opposed to community-based where it can be erratic and precarious depending on what's happening in the community. Often when people come to you, they're coming to you, it's on a voluntary, compliant basis. They're coming in to receive services. There's an appointment, all of these different things, particularly if you don't have an open access model where there's a drop in. If you're assertive field based, you're going into their home and you're engaging clients, and you may engage them over and over in different times, and you're persistent. They may not be ready. You might be using more of a harm reduction model before they're ready. Oftentimes, inside the four walls, there's an abstinence only model. However, I would say many clinics are moving away from that. Harm reduction is often more what we think of in the field. It would be wonderful if people were abstinent only, but we know sometimes that's absolutely impossible. And we also know that that's not something that is a deal breaker for still working on the road to recovery. And then the the composition of the workforce is oftentimes inside the four walls. Many of the people are licensed clinicians. There are clear boundaries and roles. Oftentimes there are those sort of walls of who does what, does the kinds of work, certain caseloads and ownership of that. The field is different than that. It's absolutely multidisciplinary. They have complementary roles. There's a shared responsibility. Clearly, we have prescribers, and there are people who are trained and licensed, and they do those things. But there's much more leeway in the field because they're working together as a team. There's much more peer support. in the community, unlicensed folks in the community that are doing field-based work. Next slide, please.
And take a look at really who are the right people to hire. This is as Karen highlighted, and as we heard in the description of the group that's doing it, Community Services. Um, this is a very different workforce. The skills that are needed are very different from hiring for an outpatient setting. So let's look at that now. We can look at the next slide. So, as folks have already noted, the people that thrive in this work are, kind of anchored, relational, persistent, but also, humble, right? They're not kind of coming from a point of view of I know what's best for you, comfortable with complexity, and really committed to providing dignity and safety to people that are very vulnerable. So the ability to work as a team to require, because this intervention requires a very flexible, sort of multidisciplinary workforce, that ability to work as a team, to know what it is that I contribute, how it is that what I bring to this team is super important. And you see more things up here. We really want to emphasize the importance of not only lived experience and familiarity with the communities that you're serving, but also people that represent that community racially, from a gender point of view, from a language point of view. That kind of mirroring of the community in your workforce is going to make people much more successful in reaching, again, a highly vulnerable population. And this really aligns with the BHSA's goals to expand access, reduce racial disparities, and strengthen workforce diversity. So let's look at the next slide. And, as you know, the demand for behavioral health services has grown dramatically in recent years. And it's driven by many things, the ongoing impact of the pandemic, other major social stressors that are affecting communities. And, at the same time that that's happening, we have this huge workforce shortage in licensed providers doing, especially all over the place, but, especially among providers trained in substance use disorders and in field-based care. And so, again, this behavioral health transformation that California is pursuing is really creating new opportunities to strengthen that workforce. Hopefully, to build some multidisciplinary teams that are diverse, culturally, linguistically, that are responsive, because they too share lived experience, and that really will allow staff to work at the top of their license. So let's look at the next slide, please. Um, all right. So we are discussing this successful outreach workers are these non-judgmental folks that are culturally responsive and comfortable working in an unpredictable community-based environment. And I think you guys really, really get that, really know that from what I've seen. Some of the key areas that you see here on the screen, this comfort in working in a fast-paced environment. That's very different than in an office environment, right? Very strong situational awareness, street smarts in a sense. Someone who has good personal emotion regulation skills, boundary management. Some of these are things that are taught. Some of them are things people just kind of come with naturally. On the teaching end, folks that are taught to be trauma informed, that are taught what a low barrier harm reduction oriented approach really looks like. Can't say enough about the need to have strong engagement and re-engagement skills. You're not going to give up. You're going to persist with folks that might be very ambivalent about entering any kind of treatment. We talked a little bit about cultural humility, this ability to do collaborative, team-based work. Often that is a skill that is taught. It's not something that just comes naturally, really working to help people be a team, work as a team. Um, and then, of course, we're going to talk a little bit more about this now, the use of supervision and data-informed decision making, which also supports retention and good work. All right, so let's take a look at that retention areas. Thanks. You can look at the next slide. As you guys know, staff stay, right? They stay in place when they feel safe, when they feel effective, when they feel seen and supported by leaders who get the reality of the field. So that's important here, right? A supervisor who really gets the reality of what they're up against. So as you know, as usual, competitive rate wages, clear career pathways, manageable caseloads, any kind of recovery and processing time after a critical incident, and that structured supervision that really integrates clinical guidance and emotional support. These are the kinds of strategies that really prevent burnout and create the kinds of conditions for staff to grow and to stay engaged and to do this work well over time. This work is deeply taxing. But it is important for us to remember that burnout is a systemic hazard, not a personal shortcoming, right? So burnout is really about how is my job structured? How is my organization prioritizing things like supervision? Not really like, am I a strong enough person to tolerate this kind of demand? Let's look at the next slide. So that yeah really means here that retention, right, depends on more than good hiring. It's this strong organizational support, and that can be difficult to find the time for, but we really want to support supervisors in coaching, in psychological safety and in managing stress and in secondary trauma. So hiring teams that have strong engagement skills, you're hiring for lived experience, not just licensure. But you're also developing some strong field safety supports here, clear protocols, team support, mobile tools so that people can say where I am, what I'm doing, where I'm going, creating realistic workloads that account for things like travel and outreach and the emotional labor that goes into this work. And then I really suggest providing ongoing opportunities from a supervisor point of view for shadowing, for training, and for a reflective practice, right? So providing those kinds of opportunities. And let's look at, thank you, Mayor. Let's look at what we mean here about supervision, right? You can hear me really pushing this issue of strong supervision as a key, right, to improving confidence and effectiveness and retention. And it is really your primary buffer against burnout. So you want to make sure that it's very structured, that it's consistent, that it's supportive, and that it applies both helping staff to learn, to emotionally integrate what's happening, to problem solve when things are getting very difficult, and to feel safe, that psychological safety, right? To feel safe about raising concerns. Reflective supervision is common, and it's common in situations that involve trauma exposed workforce, and it creates a space for staff to process difficult experiences, to manage stress, and to manage that secondary trauma, and to navigate uncertainty and complexity. So making sure that your supervisors are trained in reflective supervision, and that your organization is really implementing that is important. And let's look a little more about that. Reflected on the next slide, sorry. Reflective supervision is best when it's structured, when the time is protected, when it's consistent. So it's not just kind of on the fly supervision. There's a regular supervision time, monthly at minimum. And I think it's great to have a mix of individual and group opportunities for reflection. So you can both, know that your individual issues will be addressed, but that the team begins to, support each other and hear that they are not alone. So the sessions in reflective supervision, I don't know if you're using it now. I'd love to hear that if you want to put something into the chat. But it should really focus on, helping staff process very challenging interactions, which they're likely to have. Interactions that have strong emotional impact, ethical tensions. A simple structure that you can use can include discussing what is the situation? What were the emotional reactions? Reflective supervision does not shy away from that, right? What was the client context? But then moving forward, what are the next steps? What are the needed supports? So, reflective supervision should align with trauma-informed principles, and should really focus on secondary trauma, boundary management, healthy workforce, healthy work-life balance, taking time off, disconnecting after hours, maintaining suitable and sustainable workloads. These are the kinds of things that often feel intuitive, but really need to be structured in. And that's part of what helps to avoid burnout. Um, so let's look at this next slide about sustaining the workforce. And again, of course, folks are likely to stay when you can offer competitive pay, but you have to pay attention to that supervision and those manageable workloads, because regardless of how much people are paid, they will leave if they don't feel supported. Strong team support in the field also makes a huge difference. So I am now going to pass back over to Karen, who will talk about some other sustainability issues.
So thank you, Suzanne. So we've talked about the differences of working in the four walls and in the community. We've talked about the types and the attributes of the workers. We've talked about making a diverse workforce, how important that is, culturally, ethnically, racially, all of those different ways, lived experience. We've talked about the importance of supervision. Now I want to talk about, because I know what you're thinking is like, that's great, HMA people. How do we fund this? How do we recruit for these people? How do we do that? Well, there are two different sources of optional funding for workforce education and training in California. They are under the BHSA and the HICFA funding. The HBSA bills on the Mental Health Act dollars, and that's a provides a component for workforce education and training, right? That address California's public health, the challenges of addressing the disparities in health, the fact that we want people with lived experience, helping with access, utilization of services. So, what's important to know is that these WET funds, workforce education and training funds, they're supplemental. They're not duplicative funds. They're available through other state administrative workforces. You have to know that if you go to your policy manual, Sections A4 really break this information down for you, and it starts on page 116 if you need to dig in deeper. It includes the funding for community-based organizations or that BH Connect. They want you to use that funding first, and wet funding comes in second to that. It's supplemental. You know what? It complements the BH funding. So, what can you use wet funding for? What kinds of things can you use it for? You can use it for helping transportation. You can help for funding if somebody needs to have, sometimes if you have peer support folks and they can't afford to take the training, that you can pay for some of the training for them to do that, for your staff that has more lived experience. The supplemental workforce fundings is for stipends. It's a retention bonus that can help your group, for CEs, for additional types of trainings. So you have to go there to really find out what is possible for your team. Let's go to the next slide. It's going to talk a little bit more about allowable funds. Here you go. For internships, continuing ed, staff training for interns and support. Many times teams are using interns or folks who are working on their hours. You can use that as the supervisory time for that. Retention dollars, professional licensing. So there's a lot of things that this wet funding can be used for, supplemental, that makes employment in your agencies very attractive to individuals. Maybe you considering having a residency training program. We talked a little bit about that at the convening last week about internships and things like that. This is an opportunity for you to think outside the box in order to maintain and support your workforce. This speaks to the fact that people feel like you see them as individuals more than just a cog in the wheel. You're interested in their development. You're interested in their life outside of the work by supporting different things that they need to do, but about how to be safe in the field. This is really, really important. You have this, I have this little pyramid here. We start with sort of that social training, knowledge of the streets you have to have, those policies, procedures, supervision and support and training. I think every supervisor, manager, and director should go on a ride out. They should really see what is really happening in the field. That we can sit in these nice offices and make all these plans about what the boots on the ground should really do, but it's nothing until you really have lived that experience. You field-based staff, peer staff, and the clinical staff have to be strong clinically, but they have to be confident in their diagnosis and their treatment for the clients and for themselves. They have to also be mindful of each other. So you can't just focus like when you're in the clinic, you can get focused and in your rooms with your patients, with your panels. You also have to have situation awareness of where your colleagues are, what's happening all the time. And you have to have some street credibility. And sometimes you come with that because maybe you've got a lived experience, but you can develop street cred by being responsible, respective, and building trust with the community. I have walked in environments where they'll be like, "Oh, that's the nurse." That they will protect you because they know that you're the nurse, they know who you are, that you're respecting who they are. So these are things that stand. The other thing that's really important is you have to have some team policies, some policies and procedures that people live by. Not that just are dusted and in a policy and nobody knows them. They have to be policies and procedures around safety that people follow and believe. And finally, all of the above, this pyramid is sort of manifested through practical work of what you're really doing. Let's go to the next slide. We have some big buckets. There's that team approach and communication. The team has to be able to talk to each other. Everybody's word is valuable and means something. So we listen to everybody, not just the providers and the licensed people. We have to prepare in situational awareness. If you're walking into an encampment, if you're going into an area, if you're going into a park, you've got to look around and see what's happening and know what's going on before you get there. Listen to your gut. Never, ever take that for granted. Engagement and behavior with clients and with yourselves, making sure that when you arrive at someone's place that you announce who you are. You ask for permission to enter. You don't just, you're in their space. Remember, you're in somebody else's house. That you have safety protocols and training, that you're, if you have a mobile unit, that you're making sure that it's locked up or that there's somebody around the vehicle at all times. How you dress. You're not going into a community where you're standing out in terms of flashy jewelry and high heels. I mean, that's kind of silly. Nobody would do that, but you want to be comfortable and nothing that people want to steal from you or take from you or try to hurt you. A lot of teams wear jackets so people know who you are, that are labeled that you're the health team coming in. So they know who you are and that you are there to help. And believe that post interactions, whether something negative happens, is important, and positive. Some teams only believe in debriefs if something goes down and it's bad. I don't. I believe that every team should celebrate what happened today that was good. What could we have done better? What do we need to change? What should we keep? What strategy that you can use? It's an opportunity to share, and it helps to build team cohesion. Let's go to the next slide. So we're going to promote some safety. These are, again, I've said this, but I can't stress this enough. You have to have crisis training. Everybody needs to know how to act in a crisis. If there's an overdose, what to do in that situation, and prevention, how to de-escalate a situation when you're in a situation with somebody and you feel like it's going bad, how to move yourself out, how to calm things down, how to have boundary setting, right? You want to make sure you're going to disengage in situations that are uncomfortable. And boundaries, never giving out your personal information, never talking about your personal situation in a way that crosses boundaries with individuals. Sometimes that can be hard. If you're in a car, making sure that your vehicle is in good shape, your tires in good shape. You want to go out there and make sure your phone is working. Have a code word that everybody understands, so that if they hear that code word, that means whatever you're doing, you're going to stop and exit. A code word that you're going to use, if people hear, you're going to stop and exit and not ask any questions. So these are things that are important, and you talk about that. A meeting place, making sure that supervisors know where you are at all times, and if things change, if there's a different place you're going to move, that you've communicated that to individuals, in the back at the four walls, your supervisors, and in the team. And I recommend and stress, and other field-based teams say this: never go alone. Always, always work in pairs. Always work in pairs. And I really advise against going into a tent. You never know who's in the tent, but if you have to go into a tent, you have to have somebody else go into a tent with you. You don't want to do those things alone. And so you've got to just be careful and mindful and have your protocols and have your policies and procedures about those kinds of things. Let's go to the next slide. Again, we've talked about that prepare. You prepare, prepare, prepare before and after. Even if you are a team that's very seasoned, you want to get together and have a huddle. You want to get together and remind people what you're going to do. You want to check your equipment. You want to check your phone. You want to use mobile systems. For example, there's an app called Katana, Katana. It's a safety app for personal, a safety tool that connects staff instantly to trusted contacts, and it's 24/7 hour response. And it works even if your phone is dead. You can use this kind of an app on your phone. So those are kinds of things that you need to think about and have. I actually also think it's important to talk about um, how we respond to threats and violent instances. You know, this is when your supervisor comes in, this is when your debriefs come in, how you manage that, talking about how you felt, and then documenting situations. You still want to be able to try to service a community, but you don't want to service a community if you are going to be at risk yourself. Safety first, safety first. And what I have found is that oftentimes, if you do this planning, if you come into communities respectful, people will respect you back. People will respect you back if you do that. And so I don't want folks to be afraid of going into the community. I want us to be smart about going into the community and doing everything that we can to protect ourselves and to help people move toward health and wellness as they forward. So, in summary, field-based work requires a multidisciplinary team with everybody working to the top of their license, with everybody collaborating and sharing. Nobody's voice should not be heard. And you have to, and working with the CBOs in the community, right? Inside and outside the four walls. You know, that's the other thing that's important. The field that's outside has to be respected by the team that's inside. If they're on the outside and they say we need to bring somebody in, you have to have a reciprocal relationship. If that happens, if somebody wants to come in, not everybody wants to receive services inside the four walls. They may never want to do that, and it might just be outside. These field-based teams take care of the client where they are, and meeting them exactly where they are. They have to have different kinds of competencies. So they're going to have ongoing training on up-to-date services and things that are needed. They have to do things that are taking care of themselves and resilient. We use this word resilient so much till I'm beginning to wonder if it still means anything because it's kind of a catchphrase. But making sure that you're taking care of yourself at work and outside of work, that you're not letting work spill over into your personal life, trying to figure out ways to turn it off so that you can come back refreshed, taking those vacations when you need them, training, policies, procedures, if they might need to be modified. You can't write a procedure and not look at it again. You have to have a knowledge of the street and the community. That social teaching that you might get from a peer, you might get from your client. And supervisors play that very, very key role.
Um, Thank you so much, everyone, for joining today's webinar. Please remember, if you have any questions at all, you can email us at info@afbsstraining.org. Thank you so much and have a wonderful day.